But let me say something about social work and addiction aid from a German perspective, because there is no clear definition of social work globally. Every country, every region defines it differently. Practices differ as well, of course. So, how did the addiction aid start in Germany? Well, there were some early movements, but one a turning point really was 1968 because the Federal Social Court came to a verdict and they said alcohol abuse is a disease, and that meant that people have an entitlement to be helped. That is a central point. So we've this is anchored in law now. People have a right to treatment, and the health insurance companies were given responsibility. And that meant that addiction aid really was professionalized. Social work, of course, grew out of self-help movements, therapeutic communities. So there were lots of people who were addicts themselves, and they really started the movements here. Some anecdotal evidence, 1977 to 1982. These are cover pages of Der Spiegel. So the drugs really became a major topic here. Christiane F. was an important fictional character regarding the drug scene around the train station area in Berlin. All of this really influenced public perception and also social work, the big image of social work and drug addiction. Then the treatment model was normally one that was focused on abstinence. Then there were detox facilities, transition facilities, inpatient follow-up and therapy. Sometimes there were 18 months therapies. These were treatment periods which we can't even think of today. And then the focus, the target was always abstinence. But nobody really thought about how to deal with relapse. There were no other concepts, also how to deal with AIDS and a higher mortality rate. And there was no concept regarding comorbidities. How does one treat other psychological disorders which go hand in hand with drug abuse? Here, the HIV infection rate in Germany from the early 80s up until today. The dark blue line, that's men who are sexually active. They are the most vulnerable group. Then we've got intravenous drug users, that's the gray line, and then heterosexual people, that's the light blue. And you can see a turning point in the 1980s. What happened there? Well, we changed our way of thinking. Condoms were really advertised. Those of you who are a bit older, you might remember there were really funny campaign spots with well-known comedians. It was incredible. It was unimaginable almost that there were campaign ads on television that advertised condoms, but it was something really new in the 1980s. Then we had substitution therapy in North Rhine-Westphalia, Hamburg, and Hesse. It was another turning point. And then also the handout of sterile syringes to intravenous consumers. There was a first time that it was legally possible to exchange syringes. So quite a few things changed, and HIV was then also pushed back thanks to those campaigns, and harm reduction played an important part. And harm reduction is a concept that is closely associated with social work. And it's really a bottom-up approach towards an evidence-based practice. And in 1994, some young people, Heino, I think, has just left the room, unfortunately, but the similarities with the person being present here are just a coincidence. But there were some young people in Bremen, and they put up a vending machine for syringes. That was actually an illegal initiative. Ingo, we don't know whether it was illegal. Anyway, all of a sudden there was a vending machine, and you could get syringes from that vending machine there. So at the time, it was really unusual, almost revolutionary to come up with an initiative like this. But if you look at it today, 2020, we published this. There was an evaluation of a vending machine for syringes. That was in North Rhine-Westphalia. So there are now 110 vending machines in North Rhine-Westphalia. So it's become the political practice. It's a program that is officially funded. It's no longer a grassroots project. It's something that is now fully established. Harm reduction has also evolved further. It is a theory-based approach, but also an evidence-based intervention. So we have now interventions which have a certain evidential basis. We can show that drug consumption, rooms, drug checking, sterile syringes, and so on have a positive effect. But it's also about the consumption competency of consumers themselves. We want to develop that further. We also need a political framework, which shouldn't be a selection of individual politicians depending on the various regions. It should really be an overall concept, and that is central to our new approach now. When we talk about social work, we shouldn't just focus on the individual, but also on the social dimension as a whole. These are pictures taken in 1995, Zurich, the open drug scene, and now we've got the rollback crack and the coverage we've got today. As social workers, we really need to be active here at that interface between the individual and society, and on both levels we have to work, and we have to make sure that there's access. Now we've got an addiction policy and addiction aid in silos in a way, or different pillars. Prevention is still elementary. We are no longer focused on abstinence as the only therapy objective. Abstinence is only one objective, but there are many other objectives that are on the way towards abstinence. And abstinence doesn't need to be the only goal that we work towards. It is also about harm reduction, a higher quality of life, and so on. And addiction aid has also evolved further. So we are no longer just thinking in different steps or silos. Now we have more of a network structure, which can be quite complex, but at least it also allows access from various angles. What are the challenges? Well, it's the social legislation in silos, the heterogeneous financial resources, different funders. We also have more conflicts in public spaces. We don't have trained staff, different legal frameworks in the various regions. Sometimes we don't have enough of an evidence basis in the planning. People aren't included enough. We have different needs, and of course, the situation is a rapidly changing one. These are our challenges. Thank you very much for your attention.